And sort
Yeah,
of this
exactly.
switch flipped in my mind. And I was like, and this is 2015. And you had to still explain to people what a podcast was. And, it's like me having a radio show in my mom's basement. And I sort of pitched the idea to a bunch of friends. And I was like, I don't know, like, what if I used a microphone as an education device?
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab.U Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab.U Practice Solutions. And if you are a healthcare company, maybe you're a technology or device company doing something innovative in the space, or you're just a healthcare organization that's doing something innovative and you want to get the word out, you want to develop a succinct, effective, and unique positioning strategy for your company, check out the Healthcare Positioning Alignment Workshop. It's something we do with many of our clients. It basically helps you answer the question, value to whom? And through that, we help you develop an effective value proposition. So obviously, different stakeholder perspectives determine what they consider valuable, the outcomes they seek for either out of a healthcare service or a vendor or a technology solution even. By narrowing down that value to whom question, you have a clearer idea of how that technology, your device, your software, or even your healthcare service is uniquely positioned to solve the problems faced by your targeted healthcare stakeholder. So, again, we talk about it a lot on the show, especially around value-based care and different value perspectives and how a different one of the different P's of healthcare, you have the 4 P's of healthcare, depending on where they are or who it is that you're talking to, they're going to consider some things more important than others just by nature of how they view healthcare. So by narrowing down that value to whom question, really answering that question, you're able to develop an effective value proposition for that targeted stakeholder. So one of the big misconceptions, again, is that you develop your strategy, your positioning strategy one time and you're done. Especially in healthcare where you've got different stakeholders at play, you need to develop a unique value proposition for each of those stakeholders that you're going to target. So one of my clients recently was a company that was going to go and provide a service, a solution to providers, but then they were also going to sell part of that solution to payers. So we ended up needing to develop 2 different and unique positioning strategies and value propositions because the payer was going to view things differently. They wanted something different out of that solution than the provider would. So again, it's not just a one and done. You want to make sure that you are tailoring that value proposition for the stakeholder in healthcare that you plan to sell to or speak to. So anyways, that's my plug for that. If you want to learn more about that, head on over to positioning.rehab.upracticesolutions.com. That's positioning.rehab, the letter U, practicesolutions.com, or you can go to the homepage and I think there's a button up there that says learn more about the Positioning Alignment Workshop. All right, enough about that. Moving on, we are having, speaking of value propositions and having conversations with your targeted audience, this week I'm excited to share a conversation that I had with Jimmy McKay from PT Pintcast, the PT Pintcast podcast. If you are in the physical occupational therapy private practice space, you've probably heard of him and heard of the show. They're doing some really, really cool things. But so Jimmy is the director of communications for Mount Sinai Hospital in the Division of Rehabilitation and Human Performance and the Abilities Research Center. He's also the host of PT Pintcast. He's got a degree in PT from Marymount University, and as he shares in this conversation, he actually came to physical therapy from a background in communications and radio. So he was a radio DJ, a rock DJ, and he shares a little bit about seeing the iPhone come to fruition and what he saw as a radical change or transformation in the way uh, media was consumed by people. No more were you uh, tethered, if you would, to geographical regions or frequencies on the radio. Now you can tap into anything via online. And that became very apparent to him, who was involved, deeply involved in that industry, about the time that the iPhone came out. So he shares a little bit about his shift in mind, from his mindset from, okay, how are we going to take this into the new century, right? The 21st century, if you would. What he's doing, and the point of our conversation is really about how clinicians, clinical organizations, etc., can leverage, for lack of a better word, I hate saying like the new media because it's been around for like a decade or more, right? Many of us grew up with iPods and streaming and all of that kind of stuff coming into the market. And people now, that students that I talk to at the clinic, students that I see at the university when I go and give presentations there, or at conferences and things like that when I'm on speaking engagements, they're just used to that, right? They're why pay for things with like pay for cable with commercials or something like that if you can stream it for online for much less, right? So this idea of, okay, we've got, and we've mentioned this on the show before, but this idea that clinicians are knowledge translators. That's one of the big values that we bring to any kind of patient engagement or encounter. So what can clinicians do, one, from a communication perspective, to align our communication, as I mentioned earlier, with that prospect, that value proposition, that prospect? So we talk a little bit about that, but really, how can we leverage some of these technologies and platforms to get the message out there, whether it be for business growth and business development, marketing for our business, or just knowledge translation and increasing, one, awareness of what your subspecialty or profession does. Or, there are people, and I say this all the time about some of the stuff that we do at Proactive, the clinic that I own and operate. There are people that are watching the YouTube channel, reading the articles, watching our videos, that are never going to step foot in the clinic. They might not ever step foot in a physical or occupational therapy clinic at all, right? But what we are able to do is reach them through some of these digital means. That we're able to impart some of that knowledge to them so that hopefully they're able to decrease their pain, improve their function, increase their overall quality of life. And to me, that's still a win. And, we talk about, Jimmy and I, in this conversation, about how we can monetize some of that it doesn't necessarily need to be simply free stuff that we put out there. Like a simple example would be, ads on a YouTube channel or something like that. But there's more than one way to slice that pie, as I mentioned in this conversation. And Jimmy does a great job in this interview of explaining kind of the fundamental pieces of putting together communications plan and strategy. And then we kind of spitballed a bunch of different ways that you can monetize your knowledge, your content, without having these super, super massive audiences of, millions of downloads and followers and all of that. That if you have a valuable target, a valuable audience, it doesn't necessarily need to be super big in order to get real financial gains in your business and in your career from that. So without further ado, let's dive right into it. Here's a conversation I had with Jimmy McKay from PT Pintcast, speaking about leveraging, we'll call it the new media for business, career, etc. growth. Hey, Jimmy, welcome to the show. How are you?
I'm excited to be here. I love to talk to people who are super smart and passionate about what they're smart, passionate, or curious about. So I'm pumped, man.
Cool deal. Well, I'll take the smart thing then. I'm looking forward to diving into this with you, talking specifically about, the new, we call it the new media for PTs and OTs, and how we can use it to, expand our reach. But before we dive into that too deeply, tell us a little bit about yourself, because you've got a pretty cool background, and what brought you to what you're doing now with PT Pintcast.
It's a little weird, right? Non-traditional. So in sixth grade, I did the morning announcements, right? I mean, how many of us can say like we sort of changed our career, or like things were presented to us in sixth grade? But I did the morning announcements, and I was like, I don't know what this is, but I dig it. So fast forward, I went to school for journalism and mass communication. I wound up doing I grew up in New York. I wound up doing internships at some pretty large radio stations in New York in the summer between different years in college. And one of them, my final internship, was for this radio station WXRK, which at the time is where Howard Stern was broadcasting
Nice.
his
Yeah.
worldwide syndicated show. This is when he was also still doing like it was a TV show too. So this is the last summer too before he went to XM and satellite
Yeah.
radio. So
Satellite. Yeah.
he sort of like didn't really care. He was just kind of swinging for the fences. So I did that. I went back to my hometown radio station, the station I grew up listening to, and I got to be a broadcaster there. Wound up getting promoted. I got to help run that station. Got promoted again, moved to Northeast Pennsylvania, got to run one and then eventually two radio stations there at the same time. I was juggling, all while getting to jump in the studio a couple hours a day and play rock music real loud and give away beer and concert tickets and hang out with rock stars. And then in
Nice.
2008, this thing, which we have not prepared, but I bet you your version of the thing is no more than an arm's length away. It's this thing. It's the smartphone. This thing
Yeah.
happened, right? I almost said Bill Gates. The other guy, Steve Jobs, walked out on stage with a turtleneck and sort of introduced the world to the iPhone. A couple months later, I finally got my hands on it. Driving home from the radio station, had my iPhone plugged into my aux cord before Bluetooth. Kids, we had an aux cord.
Yeah.
And I was listening to a radio station from Los Angeles while I was in Scranton, Pennsylvania. And it was then that I realized like this is different. How we communicate, like the antenna on top of my radio station could had 50,000 watts and could reach X number of miles, but it didn't matter anymore. So time, the thing I want people to remember there is that's the moment when I realized time and space weren't going to be a limiting factor to information,
Yeah.
music, sound, voices. So I, of course, did what every middle-aged white guy did. I didn't buy a sports car, but I went back to go to law school, and I hated the thought of that. I didn't even start law school. After that, I did what every failed lawyer did: is I went to get an MBA, and I got one third of an MBA. I don't want to brag, but you can't even round up one third.
Yeah, I know.
1/3 of an MBA is zero MBA. And then I sat down and thought about like, well, what really intrigues me, right? Like what really fires me up. And I was a mediocre triathlete, and one of the guys that organized our weekly bike ride that we all met at a pizza place afterwards and drank beer and ate pizza. He was a PT, and I would just watch what he did and how people's body language changed while they were just speaking to him. Again, this was just over beer and pizza, and I would watch people walk away differently, like, oh, my back hurts when I ride, or my ankle, my knee. And he would just have this conversation. I remember just walking up to him being like, what kind of verbal voodoo are
Yeah,
you
exactly.
doing? What are you doing, man? Because I thought PT was all like this and this. He's like, well, that's part of it. And that's when I said, okay, this seems like something. This seems less one to many, which is what I was doing as a broadcaster, and more one to one. So I applied to PT school, and I had to do 8 out of my 9 prereqs because, again, I was a communications major.
Yeah,
so
exactly.
and
Had to do those anatomies and the sciences and
it.
all that stuff you skipped out on.
All of it. And I did that while still, I was in the radio studio interviewing rock stars with a physics book, and they were like, what's this? I'm like, oh, no, it's a door stopper. Don't worry. It's just, I found it. And went to PT school. And for the first year was just a, complete, head down student. And in the second year, I saw a presentation. We've all been in this presentation before. It's 1,000 people in the room, somebody on stage, and their shirt is all buttoned up and their tie is real tight, and they're using words that are, 9 syllables long.
Yeah, exactly.
You don't understand everything. And I just remember looking around the room, and I'm like, maybe, the imposter syndrome idea. I'm like, maybe I'm the only person who doesn't understand this. Everybody else is nodding. And fast forward to the networking hour, or the happy hour after, I spotted the speaker across the way, and I was like, I paid like $200. I'm going to I got to at least get one thing out of this. Right. So I was bold, and I walk up to the guy, and I was like, I'm Jimmy. I'm a second year student. Can you, I didn't really understand your presentation, all of it. Could you help me understand more? And 15 minutes later, I understood everything. And it wasn't because he was closer to me in proximity. It wasn't the beer and a half that I had. It really was, in my mind, it was because we were having a conversation. He wasn't giving a presentation. And sort
Yeah,
of this
exactly.
switch flipped in my mind. And I was like, and this is 2015. And you had to still explain to people what a podcast was. And, it's like me having a radio show in my mom's basement. And I sort of pitched the idea to a bunch of friends, and I was like, I don't know, like, what if I used a microphone as an education device and just interviewed smart PTs and just because that's how podcasts work. You just give the stuff away. And I got commended. I got patted on the back for stepping outside my comfort zone. But the irony is, I didn't step out of my comfort zone at all. I actually
I was like,
took my
this is what I normally do. I'm just gonna
right.
pivot here and use it for PT.
I wrapped myself in my comfort zone like a hamster ball, but I was able to walk around an area of a profession of physical therapy that I was new, naive, uncomfortable in, learning my way. But I was able to use this sort of weapon of a microphone and this comfort of like, hey, when I'm talking to people, I'm in control of this conversation, or at least I feel more empowered. I feel like a part of this conversation, not a presentation. So I
Yeah.
launched a podcast in 2015. I think the timing of the podcast, when podcast, not everybody and their mom like has a podcast like they
Yeah, it
do
was
today,
early in the podcast
early,
game.
early. So we got 10,000 downloads the first month,
Dang.
and the show sort of took off, and people started looking at me like, "Are you going to keep doing this?" And I was like, "I don't even know what this is." I'd love to say I had strategy, but I was sort of like, I don't know, talk to a smart person, talk to a smart person, get stuff, learn one thing, have fun, learn stuff. And I've done that ever since. And that sort of gets me into a lot of different places and helps me learn. And the best part about this is I'm sort of learning in public, and the audience gets to come along and learn with us.
Yeah. Yeah, no, I think that's a great format. I always said so I started my podcast in 2020, and the idea was like, I'm just going to talk to smart people and have a good time, and maybe people will find it valuable. And, and it's like all the things that happen just from doing that. So, did you ever practice as a PT?
Yeah. So I
Okay.
graduated in 2016. I started very much in outpatient orthopedic sports, cash based in
Nice.
Alexandria, Virginia, which is not the cheapest area in
Yeah.
the country. So I was working a lot with like triathletes, a lot of military because it's DC. It's the DC area. So a lot of
Yeah.
military. I
Contractors, all
mean,
different.
Coast Guard pilots. I had generals were in the clinic, and I didn't mind that, but I didn't love it. And then I went the other way. I actually reached out to a former guest on the show and talked to her, and she was in peds. And I said, listen, Amy, I have no experience in pediatrics, but I sort of just like, I act like a kid 90% of the time anyway. And she was like, all I heard you just say was you had no bad habits. So why don't you come check this place out and see if it's where you'd want to kick around? And I got to do zip lines and Nerf gun battles and,
Nice.
floors lava. So I practiced for about 2.5 years, but the entire time I was still doing the podcast. Different components and sections and academies of the APTA would reach out and be like, can you do this? Can you come to this conference? Can you help us communicate? So I was sort of like getting hired. First, it was just like, we'll let you in for free and we'll pay for your flight and hotel. And then I had to be like, I had people in my ear being like, what you do brings a ton of value. Like, this is you're
Yeah, you should charge for this. Yeah.
yeah, yeah. So I started, but I started displaying like, here's what I'm going to do, here's what it costs, and then here's what you'll get out of it. And I think in the beginning it was like, again, 2016, 2017, where you had to really over explain what the value of an impression or a view or a listen could
Uh
be.
huh.
And then once I started to hone that sort of explanation, people were like, oh, so bringing you out and paying you money actually brings us more money. And I'm like, right. And I can
Yeah,
help
that's
you
how it's
do it.
supposed to work.
That's how it's supposed to work, right? I'm like, if you're not making what you're paying me by a multiple of 2 or 5, you should be paying me. That I don't know what I'm talking about. So I got to do that. So I eventually left, direct clinical practice, and I've worked with some big organizations. If you want to find out who, check out my LinkedIn, but I won't name drop or anything like that. But I get to help, organizations and conferences and APTA sections, academies, or companies do this thing. And my mom put it the best way. She was like, oh, because again, I was inventing this job that didn't exist. She's like, oh, I get it. You speak 2 languages fluently. Like, you speak communications, marketing, and
Exactly.
content, whatever. And then you left that behind, but it never left. I didn't delete that. And then now you understand PT. And it's like, if you had the Venn diagram where those two things cross, I just kind of live in the middle of that space. And I can talk to the marketers and explain clinical things or patient related things to them. And I can talk to the clinicians about, hey, listen, it just took you 9 minutes to explain diagnostic ultrasound, and you're wondering why this person doesn't find value in it. I'm like, I need
Yeah,
you to do it in 2 sentences, and I can help you do that.
exactly.
So yeah, I get to live in this sort of world where I got to. I mean, how many times do you have more than one college degree and you get to use both of them? And so I get to flex
Exactly.
both of those muscles every day, which is fun for me and pretty rewarding.
Yeah. No, I think that's awesome. I think I was talking to somebody and I actually read one of their books. So the guy named David Baker, he wrote a book called The Business of Expertise.
Okay.
And one of the things he mentions in the book, and it pertains, he's talking about his consulting work and his strategy. And he's like, you need to have a wide, super wide personal life, right? Your leisure, what you're getting into, because then that allows you to kind of bring some of those patterns, some of those insights, and apply it to your specialty. It's even cooler though if you've got like if you're an inch deep or an inch wide and a mile deep in two different
Right.
areas like you are, because then you're bringing a lot of that cross pollination over. So
Yeah.
that is super super
Sarah,
cool.
I'll name drop someone because she deserves it. Her name is Sarah Beth Burke, and she did a PhD and she made up this title, which is hybridity. And I saw her on Instagram 6 years ago, and I did an interview with her, and it was cool. I looked
Yeah.
at it as cute. It was nice. It was nice to know. And boy, was she onto something. Like, and I remember I DM'd her back a couple of years later through COVID because it really was what circles can you combine? What things can cross over? Because you're not a this and a this, right? You're not a physical therapist that communicates. You're the ringmaster of physical therapy. So she was focusing on the words, but what she was really focusing on or getting people to focus on is what are these places that cross over? They're not this plus this. It's like it's an exponent
Yeah. Yeah.
because you don't have to hire two people. It's not that I'm just saving you a salary, right? I'm also able to do things that if you hired a marketer and a PT, those two people in a
There would
room,
be friction. Yeah.
it'll be right. And I can just sit there and go. And actually, I saw a movie on Netflix, and I can't remember what it was. It was about an interpreter, not a translator in the Iraqi war, right? So this guy was embedded in a Marine unit, and he kept sort of pushing back against his commanding officer. He's like, "You're here to translate," and he's like, "Actually, I'm an interpreter." And I remember sitting there thinking, like,
Yeah.
"Hang on a second, those are two different words." Translate, I can use Google Translate, and it will verbatim tell me what this person in another language is saying. But interpreter is a higher level. It's like I can
It's giving you
understand
the context, the culture, all of that. Yeah. The meaning
all of
of it.
and that's not a little bit better. That's several orders of magnitude better, right? Because you could have brought in this movie, this person was from, I believe it was Iraq, and you could have just brought someone from the US who spoke the language. But this person lived the life. They understood when this person says that word that way, they actually don't mean this, they mean that. Or that doesn't make any sense. He was able to figure out that someone was giving them bad information and walking them into an ambush. And he was like, because he wasn't translating, he was interpreting. And I remember thinking, like, oh gosh, I'm an interpreter. I got to stop saying I'm a translator between communications and marketing and PT. I got to say I'm an interpreter because that's actually more of what I get to do.
Yeah. Well, I want to back up a little bit because you did mention something in your intro, which I think is super, super important, and that'll probably launch us into the rest here. So you said there was a moment Steve Jobs came out, he showed the iPhone, revolutionized the world, and one of the things that you said was that it's no longer geographically limited. Like how many times, back in the 90s or the early 2000s when we were growing up, it was like you went to the PT that was close, or you heard about the PT that was close because they had the newspaper, the magazine, or the radio even.
Yep.
Now the world has been, again, to steal somebody else's term, it's been Googleized, right? You're not bound by your geographical location, which means if you're in the clinic or if you're a business owner, like your competitors, even if it's just for the information, are now global. It's not just the down the street. And I think that has a lot of implications, and probably a lot of what you're doing with PT Pintcast and even with the stuff with Anthony and kind of growing the influence of PT is kind of leveraging that, is it not? Yeah.
Yeah. I remember on that drive from the radio station to my apartment, listening to K Rock LA while I'm in Scranton. So the other side of and it was buffering, a term that these kids today won't have to suffer through. But that was when the connection was crappy. But I remember thinking, like, it's crappy now. It's not going to be crappy in a year or 3 years or 5 years, and started thinking ahead. And that's when I started looking at, like, I can't be the second wittiest, funniest guy in the afternoon in Scranton and make a living in a couple years. And I went back to the radio station and I was like, oh my God, something is happening. And I got looked at like I was Chicken Little, like, easy, kiddo, the sky's not falling. And I remember being like, I don't feel safe on this boat. That's why I did the LSAT. That's why I did the 33% of an MBA, because I was like, this is different. And the things that it taught me was the distance between you and the potential listener or audience or viewer was now just the thickness of the glass on your smartphone. I didn't really know it then, but I knew I couldn't just be the coolest rock station in Northeast Pennsylvania. and have a thing. I'm now competing against the world. Now, on one side of that, that's like, dude, the world all is on the outside of your door. They're right here in your smartphone. All you got to do is open this thing up. And the problem is, because it's easy access for you and I and everybody else listening, it means it's easy access for you and I and everybody else listening. So it becomes a game of what we call signal versus noise. And again, a lot of the kids these days aren't going to know the suffering, but if you're driving somewhere and you're listening to FM radio and you get further away from the antenna, it will start to get staticky, and you start to, I don't know why we squint our eyes though, Rafi, when we're like trying to listen to things.
You're trying to listen better.
Try to listen to it.
You cut into the mountain trail and it goes, what was that?
So you're trying, if you're listening to a baseball game or something, you're trying to tune the radio to get the signal, not just the noise. And that applies to this thing called all of it. Social media, just the speed of the world now and how much information is being shared. And you weren't just one of 5 radio stations in your area, or one of 3 newspapers, or one of 6 TV stations. The minute DirecTV came online or whatever, it was almost limitless. So how do you cut through that? And that's improving your message, right? So no longer could you get away with lazy copy, because you're going to get beat by the guy doing better copy. You can't get beat by just doing a webinar because there's 100 people. You got to beat that girl who's got her copy nailed down to hyper focus on what problem she solves. So yes, signal versus noise is a thing that I constantly think about when I'm writing something or creating a graphic or an episode or a thumbnail. What is this saying to my potential audience? Because I am competing against ESPN and Oprah and every other author out there trying to communicate their book. I need to understand that I need to be on that level. So it's both empowering and freeing, and also, oh man, now I got to compete. It's the world versus me.
Yeah. Well, and one of the things that it has done as well is it doesn't count anymore. It's not beneficial to be like a jack of all trades, right? Like going global, going huge like this means you have to really hyper focus and become specialized. So
Correct.
It's not, even from the practice standpoint, like you can't be just, I do general orthopedic PT anymore. Now it's like, okay, we're going to specialize. But the same thing with media. While there's huge opportunity out there that I see, like that's why I don't think there's a problem with like 50,000 PTs getting into the media game, because there's 50,000 segmented audiences that you can tap into. It's just getting hyper focused, and the riches really are in the niches. You don't need 3 million downloads or anything like that. You can get a very focused group that's very valuable.
Here's an example, because help organizations or people launch podcasts, and people sometimes, and I understand, you want to understand ROI. You're like, why am I launching this podcast? Is it going to lead to money? Is it going to lead to attention, which will lead to money? And they're like, how many downloads an episode do I need to monetize? And I have said 1. And people are like, 1? No, but how much to make money? And I said, okay, well, I'm going to give you an extreme situation, right? Let's say you host a podcast about, invasive brain surgery, and there's 10 surgeons in the world that can do this one type of surgery, right? So you talk about brain surgery, there's your niche, but it's still pretty wide. But there's only really 10 that can do this surgery, right? And you did an episode with one of the 10, and 1 person listened. 1 download. How are you going to monetize that? I don't know. If there's a company in Germany that makes the laser that makes that type of surgery 60% more safe, and 1 person listened to it, and they run a hospital in New York, and they're like, oh dude, we need that laser. And you advertised on that podcast. Now, you could advertise on that. You could have partnered with them. That could have been your message. So it really is, Tony's famous for this. Tony Maritato's famous for this. Launch a podcast in your local community, because I'm not saying time and space don't matter. I'm saying time and space matter differently, right? So let's say you do the healthy, Rafi, where are you? You're in Augusta. Healthy Augusta podcast, right? And all you do is go around, you bring your headphones, your little microphone and your camera, and you go to doctors' offices in your community, and no one ever listens. You did 1 a month. You just had 12 1-hour situations with people in your community, physicians, nurse practitioners, massage therapists, whoever. These are the people in your neighborhood, right? Yeah. And now you built 12 possible bridges. Maybe only one of those works out, but you spent 12 hours doing it. Is the juice worth the squeeze? So that, Stephen Covey, 7 Habits of Highly Successful People, start with the end in mind. So don't just look at it like, do I need to be 10 million downloads a day like ESPN? I'd say I'd stand by no, you don't, because what matters? You tell me.
Yeah. It depends on kind of what your strategy is long term, right? So maybe we'll talk about that in a minute, but like there is the strategy of like, okay, we're just going to pepper the marketplace and we're going to use we're going to get big, and that bigness is going to, translate to maybe referrals or awareness in our local
Right.
market. But there's some higher level value there, right? So
Yeah.
like I do a podcast and we don't do nearly as many downloads as you. I think maybe we're at like maybe 1,700 a month or something like that. So not super big, but
Hold on, hold
my,
on, hold on, hold on. I have to stop you there. Think about this, right? All right. So, what's a local like arena or something like a theater in Augusta, Georgia? Like a place you'd go to watch like a decent sized concert.
oh yeah, you've got like the Miller Theater, you've got Bell Auditorium, all of those.
Great. So the Miller Theater. So you're like, wow, I know in the grand scheme of the world's population, you get 1,700 people to pay attention and spend time with you a
Yeah.
month. Think about if you walked out on stage at the Miller Arena once a month and looked out, and there's 1,700 people there listening for even if it's 15 minutes.
Yeah.
So I think one thing that this thing has done is it's screwed with our perception of
The
scale.
numbers. Yeah, yeah.
1,700 is not an insignificant number. It's not, especially if they're the right 1,700 people. That's
Yeah,
different.
well, that was my point, right? Like,
Yes.
I don't need to have, if you're looking at ad spend and people are spending $5 for 1,000 listeners and all that. Like, yeah, you can't monetize that. But my audience is super focused right now. We're in healthcare innovation, so my audience are healthcare technology startups, PTs and OTs
Yes.
doing cool things in technology, and that leads to consulting deals and projects and that's stuff that's super valuable that is not monetized in the way that we think about it. Like I think
Correct.
moving into this new world, we're trying, and a lot of people still are trying to apply like old ways of monetizing it to what could potentially be, infinite ways of slicing and dicing the way you make money on the content you're creating, right? Like it's
Correct.
no longer about ad based spend
Correct.
and revenue. Like you can leverage it into partnerships and relationships, and even like Anthony says, like you connect with that doctor, now that doctor's sending you patients. Well, that's, you're not technically monetizing the podcast, but it led to your business
Right.
growing, right? Like
Right.
there's so many different ways now to make money and monetize that don't
Right.
necessarily require big audiences and ad
Correct.
spend and all of that.
I threw a party last year at CSM, or I helped some people throw a party last year at CSM, and I did it because it was personal to me. I did it because I knew how to do it. I saw what people are doing. Companies, APTA sections and academies, they come to CSM, which is our largest conference in PT, and they spend lots of money throwing gatherings because when you do things at a conference center or around a conference center, nothing is cheap, right? So
Exactly.
even an inexpensive party is 15, we're talking 5 figures, right? For food and
Yeah.
beverage and location, whatever. The thing that annoyed me was we threw a party, we felt good, and we go home. But our profession is supposedly like, transforming society by blah, 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 blah. That's what the APTA says. And I'm in on it. I'm in. And I was like, then we should be raising money to either help the local community in San Diego or Boston in February, or the community of PT, right? So I said, what if you 10 organizations, 10 potential sponsors, you gave me your money? Because I know I can spend it better. I'll throw a dope party because I used to throw dope parties as a radio program director. So enough of them, I think I pitched 30 times and I got 15 of them to give me money, varying degrees of money, right? I rented out the San Diego Children's Museum, threw a dope party, drinks, 80s band, bourbon tasting station, the slides, the cargo nets, everything was open. It was dope. That I did not monetize that. I did not take $1 for doing all that work and throwing the party, right? And at the end of the night, we were able to hold up 3 checks saying that these title sponsors got to choose their own adventure. They got to pick their charities. Great. I wanted you, the APTA Geriatrics and Kathy Cholik. I wanted you to pick a geriatric older adult facing charity. I wanted you to pick this. I wanted you to pick that. So that was fun. I did not do this to monetize my time. But several of the sponsors afterwards communicated with me a month later. Hey, so-and-so from marketing said you were the guy who helped throw that party. What else can you do?
Yeah.
So I did not do that, but several of them are now sponsors of my podcast. Now, did I throw that party to do that? I did not. But I showed, not told. This is why like the best day in 3rd grade is show and tell, right? Show and tell Fridays. It's really about the show because I'm not in tell business as a physical therapist, as an occupational therapist, a healthcare provider. You're not really in the tell business. You're in show business. There's a reason that phrase makes sense and tell business doesn't make any sense.
Yeah. No, I think to translate it clinically, like I'm huge on the clinic that I own and run. Like we're going to do test, treat, retest, because that shows the patient
Those.
in the clinic that, one, that you know what you're doing, two, that they're getting better and that there's hope, right? Like that there's something that a demonstration does that just telling a story doesn't. I think I was listening to that My First Million podcast
Great.
a couple weeks ago, and he had the guy talk about like the best ads in the world, or the ones that had the biggest impact, and all of them revolved around demonstrations. Like the guy
Demonstrations.
that made the brake for the elevator, he's like, he didn't just tell him how great the elevator brake was. He like got up there and then had the guy cut the cables, and the elevator didn't fall afterwards. Like stuff like that makes an
Yeah.
impact. So that's awesome. So from this, where we're at now, like how do you see this? What are the opportunities there for maybe your local PTs or PTs that want to get involved? They see the opportunity, they just don't really know, like,
Yeah.
what should I do? What should I be thinking about? Is this a blog? Is it
Yeah.
is it getting famous on Instagram? Like, what is the end goal, or how should people think about leveraging digital media and technology to kind of
All right.
influence or increase their influence? Yeah.
Couple things. We'll do this in a couple of really easy, simple steps. And I tell people all the time that I work with, if I start using words or concepts that you can't understand, it means I'm talking out of my ass. Because this should be the basics. This should 100% be the basics. It should be very easy to understand. It should be easy to follow because, and here's why, because the rules of relationships online or in real life, in person, are the same. And this ruffles a lot of feathers. People are like, no, they're not. They're not the same. The rules of relationships are the same. How we do those relationships and
Yeah.
how they interact are different. But what I mean is I can have a transactional relationship with someone. I can pay someone $200 to spend time with me, and that's a transaction. That's not a girlfriend. We call paying a woman $200 to spend time with you something completely different. It is, in fact, called the oldest profession. So
Yeah.
it's different because you have to earn one and you pay for one. One is a transaction and one is a relationship build. So number one, the rules of relationships are the same in person or online, right? And we have to have agreement there, because if we don't, then we're looking at things like transactions, like ad spends. And I'm not saying don't spend. What I'm saying is, what is the purpose of this? Is this to build a relationship? And relationships have different levels of depth, right? If you're
Yeah.
married, that's a deep relationship. If you have someone who watches or follows, right? That's a term that all these platforms use: follow, subscribe. It's a different relationship. I'll give you a little time or attention in exchange for something: entertainment or education. So that's lesson 2. The only 2 things you can do with content, and that's what we're talking about, is in exchange information, is educate or entertain. Now, bonus things, Rafi, if we can do both
We
of
can
those
do
things at the
both.
same time, that's the magic thing, right? It's why we know who Bill Nye the Science Guy is. It's why Neil deGrasse Tyson is fun, because dude's super smart. He's going to teach me something, and he's going to get to the damn point. And dare
Yeah.
I say, he's going to make it fun. And I remember what he says, and he's quotable. So those are the really, I know how you can do it is a multitude of ways, but what you're actually doing is just one of 2 things. You are either educating, entertaining, or both at the same time, right? So then how? I love talking about this, and I give this away. Can I throw something on the screen for people who are maybe watching the video? Do people
Sure.
watch the
Yeah.
videos? Cool. All right, I'll throw this on the screen real quicksies like. So this is the 7 W's. Now, I went to school for journalism and communication, and people all talk about the 6 W's: who, what, where, when, why, how. So, Jimmy, I know you're not a math major, but that's 6 W's. Why do you have 7 on the screen? Here's why. I think there is a right or a better order to answer those questions. And it's not that I disagree with Mr. Simon Sinek, who did have the most viewed TED Talk of all time, and his is start with
Exactly.
why. And I don't disagree with him, but I think it's different, because I think he might even agree with this as well, which is you have to start with who. Who am I talking to? And here's why.
Yeah.
Because if I'm talking to my grandmother, we're talking about different things. Our what changes. How I'm talking also changes, right? I use a lot of 4-letter words and slang with my best friend, not so much with Megami, right? So this is the order for me in terms of what questions anybody should be asking when you're going to communicate, or you're going to try to exchange value, exchange time and attention for pay and spend. So the first question is who? Who am I talking to? And I like to niche down. What was the phrase you said before? The niches is the riches and the niches?
Riches are in the niches. Yeah.
I've never heard that before, but I'm writing that one down. So
Yeah,
I
some
like to
popular guy wrote it, not me.
it's cool. I like to niche down at least 3 times, right? So Oprah Winfrey, Amazon, ESPN, to a degree, they can talk to everybody. The rest of us, we have to figure out who we're talking to. You can also have multiple audiences that you talk to. So I'm not just saying you have to pick and that's all you can talk to. You can talk to just like ESPN, sports, but they also have hockey fans and football fans and baseball fans. And sometimes I'm a fan of 2 or 3. So who is first? And I remember this by saying the owl says, who, 3 times. That's the best sound effect you're going to get out of me. Next up is why this isn't 6 W's, it's 7 W's. Is because I asked the question, what, twice. On the left, or the first time I ask what, is I want to find out about that who, that person that I'm talking to, my audience. I want to find out about their bads and goods. Where are they now? What are their frustrations? And where do they want to go? Where are you? Where do you want to go? And why haven't you gotten there? Tell me about that. And make sure it relates to you. And here's the example. One of your ideal audiences might be runners who want to finish a marathon. That sounds great. They might have a flat tire. That sucks. And that is a valid concern for them. But that's not what you're going to talk about. You're not going to talk about flat tires. You're going to talk about they're wanting to go from the couch to a PR at the marathon finish line. So make sure what you're focusing on, their bads and goods, as I call them, relates to you. On the right, the second time I ask what are you good at? What do you like to do? Just because you make money on it doesn't mean you should do it, right? You should like doing it as well, because that's what you're going to do. So I like to list out what are my tools? What are the things? What are the valuable things that I can bring? My insight, my degree in physical therapy, my ability to communicate with people. And when you write those things down, their what and your what, where those 2 things cross over, or multiple things cross over, that's where Simon Sinek made a career, saying, this is our shared why. Yeah. And from there on the screen, you can see I made how, where, and when, black and white, same shape, in order. That's a process. That's where media comes in. The biggest mistake people make is they skip right to how. I want to communicate, so I'm going to run ads. You're going to spend money and run ads, but you don't know who you're talking to, what their problem is, what you bring to the table, and what that shared why is. You're going to spend money? Risky. So once you figure out that shared why, the how, where, and when you communicate, that gets real fun and simple. Because marketing, here's the final lesson. Marketing is honestly saying the exact same thing 1,000 different ways. I'm not asking you to say 1,000 things. I'm asking you to say one thing 1,000 different ways. And then we can go to exercise principles, which PTs and OTs are familiar with. And they're a perfect parallel to communications. Frequency, that's a communication or exercise principle. Intensity, time, type, volume, and progression. That's exercise principles. That's the FIT VP paradigm that the American College of Sports Medicine came up with. Those are communication principles, friends. That's the world I lived in. Frequency, intensity, time, type, volume, and progression. So those 7 questions are important. I think this is simple, but not necessarily easy. There's entire professions of people called marketers and communications professionals that will help you do this. Just as I talk to communications and marketing people about when their back hurts, that there is an entire profession of people that can help you get rid of that or do what you want. So I think a lot of times we overestimate our ability in one thing in terms of healthcare and say, well, how's this marketing thing? I mean, I don't want to be a jerk or anything, but their projects in college didn't look that hard, right? Yeah. But it brings value. So either learn how to do it yourself or hire out. Know when to refer out is my last suggestion.
Yeah, that's awesome. What would you say to people who feel like we get this a lot, or I hear this a lot, I just don't know enough to do it? Or there are people that know it more than I do, right? Like I'm not a certified hand therapist, so I shouldn't be doing anything with the hand because there's somebody out there that's better than me.
Yep, exactly. And I think we need to be humble about that. Listen, there are PTs who are just naturally good at communicating and marketing. Yeah. Awesome. That doesn't mean all of us are good at communicating and marketing, and that's okay. So you can teach yourself. You could hire a coach to do it, or you could hire someone to do it completely yourself. So by yourself, listen, you got Google and ChatGPT. You can't figure this out. That's okay. Hire a coach to teach you in a month or 3 months or whatever. I mean, $1 million business owners hire business coaches because they're like, I'm really good at these 3 things, but I need to be good at these. So do what Steve Jobs said, which is either you hire smart people and you let them tell you what to do. You don't hire smart people and then you tell them what to do. Why the hell would hire an idiot and tell them what to do? How does that work? It doesn't. That's the thing.
Yeah. Awesome. Cool deal. Well, I mean, I think that wraps up at least high level here. So, where can people find out more about you?
Yeah.
Obviously, the podcast, all your projects. Send us
Yeah.
to all the places.
I keep it simple. It's at PT Pinecast or ptpinecast.com or on LinkedIn. My actual name is Jimmy McKay. People call me the Pinecast guy. And the reason, Pinecast was, it goes full circle to the first thing I said was I really wanted the communication that I shared to sound, unbuttoned. I didn't want it to sound like the
Yeah.
tie was tight. And I didn't want to sound like I was using, 5-syllable words when I could be using single-syllable words. So that's the fun part, is once we figure out that this is valuable, communication has value, you're going to be able to spread that value around very clearly. Clarity is the goal.
Yeah. Awesome. Cool deal. Well, Jimmy, thanks so much for taking your time, and have a good one, man.
My pleasure.
I hope you enjoyed that conversation with Jimmy McKay, all about really communication basics. We're just translating it over to digital media. I think one of the things that he said that is worth highlighting again and again and again is the rules of relationships, and really the rules of communication don't change much, and actually don't change at all, regardless of the platform that you're using. And he made the point, you have to think about the reason you're having this communication, the reason you're putting this communication out there. Is it to drive a transaction, buy now, or is it to build a relationship? Because those, obviously, the goals, as Jim Rohn said, destination determines direction. So if you know going into it that the goal of this communication is to drive some sort of transactional relationship, some kind of transaction, like, that's good. I'm not disparaging that at all. You just have to understand that, because it changes the strategy a little bit, changes how you phrase things or what you communicate. If the goal is to build a relationship with prospective patients, prospective clients, new maybe referral partners or business partners, those communications need to be tailored with that end in mind. Again, destination determines direction. So I think that was very much worth highlighting. I think that one of the things that got me early on when I started this podcast, which was back in 2020, I started it really because COVID happened, and I use it as a business development tool for a while. And the reason I decided to go with the podcast was, one, I just like talking to people and interviewing people, but the relationship that you build during an interview, even if it's, semi-transactional, I guess you could call it, there are people that have never done business with me, have never paid me a dime, but they were on the show. We had a conversation, and either I was able to connect them to somebody that helped them or their business or a colleague's business, or they were able to do the same for me. So early on, I wanted guests on the show that were doing things that were interesting and fun and worthwhile sharing a spotlight. I think like episode 2 or 3 was a Dr. Rob Lambert's from, now they're called Welcome Health, but they were a direct primary care clinic in Augusta, the city that I'm in, and we talked all about stepping out of the insurance model and going direct to consumer with like a subscription-based healthcare. And to me, that was super, super, super interesting. And that conversation kind of started a relationship, a professional relationship between this doctor's group and myself. And now that I've got a clinic, we send patients back and forth, and it's all because, we know, like, and we trust each other for the most part, right? Right. So and that kind of leads us into this idea that there's different ways to monetize the content that you're creating, the insights that you're putting out there, that it doesn't necessarily need to be this thought of, okay, I'm going to generate 1 million downloads, and at, $100 per 1,000 downloads or whatever it is, that's how we're going to generate revenue for the show. We've never sold ads on this show, and I don't necessarily know if we're planning on ever doing that. I'm just having a fun time doing it, and we're having conversations with people that are doing interesting things, and it opens up doors. There are tons of people that have come to me to do things like the positioning alignment workshop, shameless plug there, or bought the book, or taken one of the courses, or come onto one of the webinars because of the podcast. They haven't had any other real interaction with me at all, other than either their colleague was on the show or they listened to the podcast because there's someone in their network shared it with them, or they came across the podcast, and that led into some other type of professional interaction between them and myself that would have not otherwise happened if I wasn't doing it. And I get the added benefit of sitting down with people who are a lot of times way smarter than me. Well, not a lot of times, like every time. They're way smarter than me, especially in the topic that we're discussing. I'm able to kind of dig into conversations and topics and areas with people that are experts in that field, in that specific niche, and I would have no business talking with them other than the fact that I've got this podcast and where, you know, there's some kind of mutual benefit there. So I think we've been thinking so small about media and content and what creators can do with it, especially clinicians, because we do have a lot of valuable insights that are going to benefit a lot of people, especially like in the musculoskeletal pain space. I know plenty of clinicians who are better clinicians than myself by a long shot, way better. They're smarter, they're more capable. They have better, you know, hands-on manual techniques. They know the most effective interventions for certain dysfunctions or whatever it is, and they don't have a voice yet. I'm hoping that some of these people jump on some of this content creation, because that content in and of itself is going to benefit everybody as a whole. If nothing else, it means the patients that come to them because of their content are going to already kind of know what's up. They're going to be bought into the treatment plan or the intervention or the treatment approach. Maybe referral partners get into some of the content and begin referring patients to that clinician because they know, they trust them. They've heard their viewpoint on this approach to this specific issue or injury, and it's going to benefit them. So anyways, I feel like I'm rambling now. I think it's super interesting to talk about just leveraging what we all take for granted sometimes, being, digital media, online, streaming, YouTube, all of that kind of stuff, and leveraging it in a way that might not necessarily make money in the traditional sense, but that can pay huge dividends down the road from maybe an awareness standpoint, a quality of life or impact standpoint. I mean, that's kind of why we all got into healthcare, right? We wanted to make people's lives better. And I see leveraging technology, leveraging digital media like that as a very simple and cheap way of doing it. So anyways, my thoughts on that. If you like the show, share it with a friend or a colleague that you think would benefit from it or find it insightful or entertaining. I'll give the plug now. We are near the tail end of December 2023. We have probably a couple more weeks left on the 2023 technology in physical dysfunction or musculoskeletal survey. It's on the website. You can go to rehabilitation.com, fill out the survey. We'd love to hear from you if you're an outpatient clinician and you're using some kind of technology in practice. Love your input. Go to rehabilitation.com and fill that survey out. We'll be publishing that. I'll probably do a webinar on the results once we get it all analyzed and written up sometime in Q1 of 2024. So look out for that. If you want to stay up to date with everything we're doing on the show, catch show notes and all of that, you can go to betteroutcomes.show, sign up for the email list. We'll let you know when a new episode drops. I think that's it. Maybe get the book, Better Outcomes, A Guide to Humanizing Healthcare. You can find more about that at book.betteroutcomes.show. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabilitationpracticesolutions.com. We'll catch you on the next episode.